Hello everyone, so let's discuss the new topic today, that is ankylosing spondylitis. So ankylosing spondylitis, it is a seronegative arthritis. Why? Because it is a rheumatoid factor negative, but it is the HLA-B27 positive. It is the HLA-B27 B27 positives. It is HLA-B27 positive. So remember, it is the seronegative arthritis, it is the rheumatoid factor negative, but it is the HLA-B27 positive. That is the important key marker you need to remember, because this is the important keyword as well for all the questions. So that is HLA-B27 positive. Now the questions come, which is the first site of inflammations? Which is the first site of inflammation? The first site of inflammation is sacroiliitis. The first site of inflammation is sacroiliitis. What does mean by sacroiliitis? That is sacrum plus ilium. They will having the inflammations, and due to which the patients will having the lumbar pain. The patients will having the lumbar pain, due to which the patients will having the lumbar pain. The first site of inflammation you need to remember, that is the sacroiliitis. Now we need see, if we want to diagnose the ankylosing spondylitis early. So for early diagnosis of ankylosing spondylitis, what we will do? We will do the MRI. And remember guys, the MRI is what? That is the investigation of choice. The MRI is what? It is the investigation of choice. The early diagnosis of ankylosing spondylitis, it is the MRI, and MRI is what? It is the investigation of choice. See, in ankylosing spondylitis, the vertebra will be looks like the perfect square. The vertebra will be looks like the perfect square shape. Perfect square shaped. If we do the X-ray, so what we will see? We will see the bamboo spine. We will see the bamboo spine. We will see the bamboo spine, and also this condition is known as the poker's spine. This condition also known as the poker's spine. So remember the bamboo spine or the poker spines. Why we called it? Because it is due to fused appearance. It is due to fused appearance of spine. The vertebra, they fused with each other, and to why they fused? Due to bridging syndesmophytes. Due to bridging syndesmophytes. Okay, so this you need to remember, the bamboo spine, or this is also known as the poker spines. So it's due to fused appearance of the spine due to bridging syndesmophytes. See, other things or other conditions we can see, other sign we can see in this condition, that is the dagger sign. Other sign that we can see is what? That is the dagger sign. Dagger sign is what? Dagger sign, we will see there is a calcification of interspinous, the calcification of interspinous ligament. There is a calcification of interspinous ligament. Along with that, after the dagger signs, what other signs we can see? We can see there is a railroad track sign. What sign we can see? The railroad track sign. See, the railroad track sign also, again remember the things. See, there is a calcification. There will be the calcification of bilateral. There is a calcification of bilateral paraspinous ligament. There is a calcification of bilateral paraspinous ligament. So remember these things. We can have the bamboo spine or the poker spines. We can have the dagger signs, and we can have the railroad track sign. So remember, these are the important, like the sign we will able to see on the in case of ankylosing spondylitis. So I hope this is clear till now. And this is all about the ankylosing spondylitis. Again, one word you can remember with the TB spondylitis. Again, the TB spondylitis is the major topic. So for now, just remember the in case of the TB spondylitis, we will see there is a paradiscal involvement. The paradiscal involvement, and also you can remember in case of the TB spondylitis that there is a pre and paraspinal abscess, because TB is what, that is the mycobacterial infections, so due to which there is a abscess formations can be seen in case of TB spondylitis. But in case of ankylosing spondylitis there is nothing like that. It is the type of like inflammation, that is seronegative arthritis. The first site of inflammation is the sacroiliitis or the lumbar pain, due to which the lumbar pain will be there. The early diagnosis we can see in case of ankylosing spondylitis, that is the MRI vertebra will be looking like the perfect square. There will be the bamboo spine, the poker spines. Along with that we can have the fused appearance of the spine, and we can have the dagger sign. Along with that we have the railroad track sign. So all these are the important points about the ankylosing spondylitis. I hope you enjoyed these sessions, and if you like this video, please consider the subscribe button and press the bell icon so that you can get the updates for the new video. So tab tak ke liye bye bye, good night, Hare Krishna, Radhe Radhe. See you in the next video. Bye bye.